deadly new GOP plan to rapidly privatize Medicare Advantage or Medicare through Medicare Advantage. And here's how it works. And those of you who've been listening to the program for a long time know most of this, so I'm just going to condense it very quickly. Medicare Advantage is not Medicare. It's allowed to use the name Medicare because in 2003, when George W. Bush got this thing pushed into law with his Medicaid Enhancement Act, or Medicare Enhancement Act, the lobbyists, the health insurance lobbyists, knew that if they could sell a product to seniors and call it Medicare, Medicare has such a great reputation because Medicare pays your bills. Medicare doesn't hassle you. You don't have to jump through hoops on Medicare. So, basically so they created Medicare Advantage. Now, Medicare itself does not advertise. They don't have an advertising budget. So every year, the Medicare Advantage providers, who are ripping us off to an estimated $140 billion a year, according to Physicians for a National Health Program, these guys, when you're grifting $140 billion, you can easily spend a few million on hiring some washed-up football player to go on TV and pitch your product. And in fact, the company that hires Joe Namath has been sued by the Federal Trade Commission for false advertising, and they had to pay a $100 million fine. But they're still going to be allowed by the Centers for Medicare Services to continue advertising with Joe Namath for their scam products. What's happened is because Medicare Advantage, which is not Medicare, can advertise and Medicare can't, more and more people are signing up for Medicare Advantage. And also, the Trump administration expanded Medicare Advantage, allowing them to offer dental and vision and hearing and $0 premiums in ways that they could not before. So now they've got even more goodies that they hand you on the front end, which of course they'll take away from you when you get really sick as you get older on the back end. They will basically start denying. Well, according to the New York Times, 18% of all the time, if you have Medicare Advantage, and we heard this from Ziggy, who called into the show earlier in the week, or maybe it was late last week, and was telling us about his visit to the hospital, and the people around him who were using Medicare Advantage, didn't have traditional Medicare, were having to wait hours. One guy had to wait overnight to get a test because their insurance companies wouldn't approve them. Well, if you got real Medicare, no approval is necessary. They don't make you jump through hoops. If your doctor says it, Medicare writes the check. It's that simple. But not Medicare Advantage. If your doctor says it, Medicare Advantage says, wait a minute. We want to figure out if we want to pay for this. And 18% of the time they say, no, we're not going to pay for it, which is, millions of denials. So anyhow, this bizarre scheme that the Republicans have come up with, this is part of Project 2025, is that when you turn 65, right now you've got to go through this whole song and dance to sign up for Medicare if you want. You've got to go to the Social Security office and sign up for Social Security. You got to talk to the Medicare people and sign up for Medicare. You got to find a Medigap plan. It can take months. On the other hand, you can also just call up one of the insurance companies that advertises on TV, and they'll put you on Medicare Advantage in 60 seconds. So, there is a convenience factor working in favor of Medicare Advantage. Well, the Republicans want to radically increase that convenience factor. They want to make it so that as soon as you turn 65, the government automatically picks a Medicare Advantage plan in your community and assigns you to it. So boom, suddenly you're on Medicare Advantage. And if you don't want to be on Medicare Advantage, if you want to go to traditional Medicare, you have to jump through all these hoops of calling up the companies and begging them to let you go and calling up Medicare and showing up in person. And like I said, it can take months. So keep an eye on this. This is going to be a big deal, frankly. And if the Republicans get control of the House, the Senate, and the White House with this election in 2024, which, like I said, I consider extremely unlikely, but I'm never betting on anything again after 2016. If the Republicans gain control, that will be the death of Medicare, of real Medicare. And then at some point when only 20, 30% of us are on Medicare, they'll just say, we're just going to shut it down.